Hey guys, so I'm here to talk about shoulder surgery, which is like Latarjet surgery to be exact, and it's the shoulder surgery. And first of all, I would like to say that this is my first video on YouTube, and I'm gonna make a lot of mistakes while speaking, while explaining you. Wouldn't be that fluent. I would be a bit nervous. So please, guys, please forgive me for that. Uh, Please subscribe my channel because I have a lot of knowledge about shoulder surgery. Like I'm still in the process of my rehab, and I would tell you each and everything about that Latarjet surgery, why it happened, like why you have to undergo, when you have to undergo, first of all, and what is the pros and cons, and each and everything from the surgery pre-operative part to the surgery part and the post-operative part. So the first thing about Latarjet is when you have to go to a Latarjet procedure. We have to undergo Latarjet surgery only when you have a bone loss in your shoulder. In your shoulder, that means either in the shoulder socket, which is the glenoid, either on the in the humeral head or both. And the loss percentage in that case for Latarjet is 20% or more, because as you know shoulder socket is small and humerus head is big. So in that case, what happens when when you have repeated dislocation, there is chance that when the humeral hits the socket again and again on the corner, the socket gets has a bone loss, like it puts a crack on that, because both bone like the socket is very hard bone. So whenever a humeral head hits it, there's the damage is going to happen. So in my case, it was around 20% of bone loss, and the socket become more smaller. And I used to work out. I wasn't very happy because of my. I was not able to do shoulder workouts that well, only the lightweight. So when I tried, I tried my best, but at the end I had to go for the surgery. So like this is my 7 weeks done after the surgery, and the progression is good. Obviously feeling of weakness is there, the range of motion still I'm working out on it. I would give you each and everything, each and every information about it. So first of all, Latarjet is an open surgery. It is really painful after the operation. Like obviously you won't be able to know when the operation is being done on that, because you would be on anesthesia. So Latarjet surgery is a major surgery first of all, and it will give you a anterior stability again. It gives it what Latarjet surgery does is it makes your socket bigger. Like uh, what is the process is, there is a coracoid. The Latarjet procedure uses a coracoid process. So what is coracoid process? A coracoid process is uh, a bone which is attached to your shoulder blade, which is around your shoulder blade. So what the surgeon does is he cut that bone 2.5 to 3 centimeter and sit and just attaches that bone to the shoulder socket. So in this case, the socket becomes bigger, and how he attaches, this is through screws, two screws. Fix that, and in that case, the bone gets healed, and both the bone get a union thing, and they act as a full bone then, and the area increases, and there is a tendon attached with the coracoid. When they cut they have the tendon attached with the coracoid, and this act as a dynamic sling effect. So whenever you do some upper activity, the anterior part gets active of the shoulder. In that case, it provides dynamic sling effect, which reduces the chance of, like, it is like 90%, 95% of cases you won't re-dislocate your shoulder again, who had gone surgery, right, who had this injury. So I would like to show you my scar in that case. So this happened on my right shoulder. As you can see, this is the 5 centimeter of incision that was made by the surgeon. I guess it's looking very bad, but never mind. You have to do something. You have to survive. Like if you want to get back into your lifestyle, gymming lifestyle, you want to stay active in your sports, and you're having this issue, you have to go for this. You don't have any other options. This is really frank. Many people say that like you can do physiotherapy. It is all bullshit, yeah. I have tried each and everything. I tried stuff like, because you know what, the mechanism is being changed. Like your socket becomes more smaller, then the human head won't be able to sit there. That's it. There's nothing you can do. No, not any kind of medicine is there to get the bone back into place. The bone is gone, gone, gone. That's it. So this is the scar. So like after the post-operative, like I would say the first 10 days are really, like the first 2-3 days are painful. Even you might get some fever also for that after the operation. It is okay, it is normal, it is nothing to fear about. It's painful 1 or 2-3 days, but you would get like the surgeon would give prescribe you painkillers as well, so nothing to worry about. And regarding the range of motion, like the physiotherapy thing is, you start passive, like you start normal range of motion exercises, like a bit assistive, like you stand in front of the wall and you just do like this, right? This is the first week I did, nothing else, nothing else. And after the first week, I went to the surgeon again, and he gave me some exercises. Like I would like to show you for that. It is like this, by just like this I've done, and again same like this. So these kind of exercises I would explain you in the next video, all the exercises phase by phase. So this is regarding about Latarjet surgery. It is really important, guys, that you need to take this surgery very seriously. If you want to again really get back on track, you need to make effort after the operation. Yeah, after the surgery you need to be bang on target. Right, currently my situation is 7 weeks post-op. Still I feel weakened because it would take time, because after the socket has been like the shoulder has been reconstructed, all the muscles have been like fixed again in their own way. Like it is not that natural now. Yeah, right. And first, the main thing is, after the Latarjet surgery, your range of motion won't be normal as earlier. It would be less in external rotation. There would be some restriction in that, and you need to take care of that. That I would like, it would be confusing for you, but I would like to say you tell you guys that don't worry. In the next videos I would tell you each and everything about the rehab phase and how it works, and how the progression is gone, how I have done my progression and how it is working on, and what is the mental effect on that. So please guys, subscribe my channel and stay tuned for more shoulder surgery exercises as well, and shoulder surgery tips, because I have a lot of knowledge of that, and I am really confident about that because I've searched a lot about it. Like before going to surgery, I was feeling like I'm a surgeon, because I used to Google each and there is, I guess, 80% of the content on the Google I've searched about this surgery, about why it is, what is the mechanism behind it, and how it happens. So bang on. So stay tuned for the next video. Just subscribe my channel. Hulala.